Get started. Hi, everyone. Thank you for joining us today. This is Olivia Kirkland with the Lucille Packard Foundation for Children's Health. Thank you for joining us for today's pre-application webinar for the Request for Proposals, Developing Goals and Strategies to Improve the Care for Children with Chronic and Complex Health Conditions. During this webinar, we will be reviewing the overall application process and also providing an overview of what will be expected out of each of the grants. Before we get started, I'd like to briefly go over a few housekeeping items. Please note that all attendees will be muted for the duration of the webinar, but questions may be submitted at any time by entering them into the chat box that's listed in your GoToWebinar window on the side of your screen. We will do our best to answer all of these during the webinar itself or during our Q&A, which will be held at the end of the webinar. And with that, we can get started with introductions. Well, before we get started, please note that all of these slides, along with the recording, will be posted on the Foundation website after the webinar. So they will be available for anybody who wasn't able to call in or if you wanted to refer back later on. But I'll go ahead and get started with introductions. So the Lucille Packard Foundation for Children's Health is a public charity focused on elevating the priority of children's health and increasing the quality and accessibility of children's health care through leadership and investment. Our speaker today is Dr. Ed Shore, our Senior Vice President of Programs and Partnerships here at the Foundation. And I will go ahead and let him take it away and get us started.
Thank you, Olivia. And welcome everyone to this webinar. We have actually a great turnout. My hope is that we can go over some background about the Foundation and our intent with this RFP, and then go over and highlight some of the things in the RFP. We did get 20 or so questions in advance, and I'm going to try to integrate the answers into my presentation as we go through that. We're still monkeying with the RFP a little bit as we go forward. We don't do RFPs very often. We're actually a very small foundation, and usually it's large foundations that do this kind of work. The goal of our programmatic work is to improve the system or systems of care upon which children with chronic health conditions depend. So we take a very systematic view of what we would like to accomplish. We've been working in this area since 2007. It's apparent to everyone in the field that system change is difficult. The majority of our work is focused on improving systems of care in California, but also supporting national projects that can be applied universally to the care of children with special needs in the U.S. We have a general interest in improving the system of care, but we have some special interests in care coordination, self-management support, and family engagement. And the Foundation sub-website is listed on this first slide that you're seeing. And you can, if you want, look up the various grants and publications that we've done. We are focusing on the care of children with chronic and complex conditions. We like to remind people that, in fact, adult medicine has a long history of engaging in the care of people with chronic illnesses, particularly the Medicare program, and several foundations have been addressing that. I don't know that there are other foundations addressing childhood chronic illness in a systemic way. Which makes our work that much more valuable, but also that much more difficult. So in last December, we had a symposium, which I hope many of you were able to attend, on designing systems that work for children with complex health conditions. The proceedings of that symposium have been published. They're available on our website. When we had the symposium, we had quite a long list of potential topics that we might cover. We went through a national advisory committee to try to figure out what we should include and what we would not include. That's a somewhat arbitrary decision, as is what we're intending to cover with this RFP. At the conclusion of that symposium, we felt that it had been very successful in identifying the many challenges that related to each of the issues that we covered. And there is a special supplement to pediatrics that's in preparation now that will expand on some of the presentations that occurred at that symposium and are related to kids with chronic and complex health problems. We did feel, though, that the symposium fell somewhat short in determining what the next steps ought to be to make progress in improving the system of care. I mean, that was a function of time. So I would encourage you to either watch the symposium webcast or look at the symposium proceedings to kind of see what the lay of the land is in terms of what we know. What this RFP is intended to do is to take it the next step. We feel the field would benefit from thoughtful plans of action in each of the topic areas that have been identified. And we are hoping that those of you who work in this area can help us accomplish that. So we hope to move beyond identification of issues to the formulation of feasible action plans for systemic improvement. Is the next slide. So let's move on to the next slide. Thinking about actions, this may help you as you think through what you're proposing. I mean, there are actions in the forms of research and evaluation. There's actions in forms of educating various stakeholders. There's actions in terms of advocacy, which has a broad definition, including policies that ought to be implemented. And there's action in terms of communicating what we know to key people. So these are kind of a checklist to help us at least think through the kind of activities we might do, and we hope it might be important and useful to you. The next slide is a slide I like to use a lot. It's based on work by Julia Richmond and Milt Kotelchuk, saying that if you want to be changing policy, you need these three categories of activities. You need a knowledge base, you need to have social strategies, and you need to create political will. So in the next slide, I've modified this to kind of our work on children with systems of care for children with chronic and complex conditions. We need a knowledge base, including evidence and data. And to some extent we have that, but there's a lot of questions that remain unanswered. And so part of what we need to move forward is to make sure that we have the information we need. Then we need to have approaches. What are the strategies that one would implement, or models one would adopt, or tools that one might employ in order to change the system? And finally, we need to think about what are the incentives that need to be in place that will encourage providers and payers and policymakers to use the knowledge, identify the approaches, and move towards system change. So the action plans we're hoping people will be developed are going to be built on, I think, these kind of three categories of work. Next slide is from some work we've done at the Foundation trying to come up with an idealized model of healthcare for children with chronic health problems. But the point I want to make with it today is this is a really complex undertaking. And in order to be successful, we're going to have to engage a broad group of stakeholders: consumers, healthcare providers, administrators, payers, policymakers, and others. So in the RFP, you will see that we've asked for the work to be done by work groups that the PI would identify and organize. But we set at a minimum that there ought to be a pediatrician on board who has experience with caring for kids with complex healthcare needs. There needs to be a family member with a child or a youth or the youth themselves with special health care needs. There needs to be some kind of health plan administrator, so we get the business side of things. And since Title V, Children with Special Needs, and Medicaid are big players in this arena, that work groups ought to have at least one of those kinds of people participating as well. And we expect that the applicants would have a much larger group of stakeholders there, but it obviously has to be manageable. Next slide. With the help of an external group of experts, we decided to look at the symposium content and then to try to pick a limited number, even from the symposium, which was limited, of topics that we would like to solicit proposals for action plans. So we've come up with 6 topics, and the list is in the RFP and on this next slide. We know that we are not covering a lot of topics of particular interest to a lot of individuals. These are not necessarily the most important in individuals' minds. It's a consensus process, but we thought that these were topics that at this point in time in the development of systems of care were worth considering. So tiering, how do you differentiate groups of children by their personal health conditions and the social factors that are affecting them? And perhaps if we can move that far in allocating and financing services based on a tiered process. As I said, family engagement is one of our key interests, and we want to ensure and enhance the role and participation of families in aspects of the system. Since children with special needs increasingly have long lives, we need to be thinking about how do we approach developing systems of care that incorporate a life course health approach for them. Quality improvement is the next topic. Obviously a very expansive one and has to be narrowed down as people approach to using this. We have thought that if we can get Medicaid programs to start focusing on quality measurement and data to drive program improvement, that may be difficult, but perhaps the low-hanging fruit, since they have some obligations and are funding a large portion of the care of these kids. I'm sure everyone on the call today appreciates the importance and value of care coordination. It remains a difficult to define concept, and there are a variety of ways of approaching how do we provide it. We need some guidance on an action plan for moving care coordination forward. And finally, children with chronic and complex problems, by definition, are going to receive long-term care. Some aspects of their care are kind of pulled off to the side sometimes: home health care, palliative care, some institutional health care. And we would be interested in action plans that figure out how do we integrate long-term care in those settings with the long-term care that's provided through complex care clinics and other vehicles. So we're looking for proposals that lay out action plans for how to move forward on each of those 6 topics. The product of these grants is expected to be a brief report. We are hoping for lengths of 3,000 to 4,500 words, plus tables and figures and citations. I think that's probably a goal we'd like to achieve, this so that the reports are short enough for people to read, but long enough to provide essential information. these reports need to provide guidance, action plans in the form of specific, feasible, and scalable recommendations for the actions needed to improve the system of care. Next slide, please. Just some guidance, and this is in the RFP, of things that ought to be in these reports or considered in them. The reports will obviously center around recommendations that are made for actions that should be taken, but those recommendations ought to be justified. Don't spend a lot of time on that, but it should be sufficient so that people understand why you're making that selection. It's going to be important if you make a recommendation that you figure out who's going to lead in that action and who's going to participate in that action. If you say somebody ought to figure out how to pay for such and such, we'd like to know who you think that somebody ought to be, whether that's an organization or an individual, and who else ought to be participating. The various actions that we expect people will recommend are not necessarily going to be linear or sequential, but to the extent that you can identify a sequential timeline for implementing recommendations, that some things will need to be done before others, that would be helpful. And if you can identify intermediate outcomes from different actions, different recommendations, that is also going to be clarifying. You need to identify various tools and strategies and approaches that you think will be used. And we'd like people to give some thought to, if these changes are made, what's it going to take to sustain and spread them, although I think that's of lesser concern at this stage. Next slide. As I said, we're a small foundation. We're going to be able to award up to 4 grants. Each grant may be up to, but not above, and hopefully below, $50,000, including indirect costs. We expect these projects can be done, since they're really primarily expert opinion and consensus, in 6 to 9 months. And as I said, we'd like each to produce a brief report, the core of which is an action plan that's associated with recommendations on one of the topics that's selected. Next. If you go to our website, which we had the address up before, the Lucille Packard Foundation for Children's Health, and look under the Children with Special Healthcare Needs Programs and look under Grants, you'll see this page. And you'll see there's 2 boxes to the right. If you click the one that says Application Process, this is our general application process for any proposal, not specific to this request for proposals. Next slide. So all the things in here pretty much apply. So I think it's general guidance for how to put together a proposal. One of the things we've changed is we are not asking for letters of inquiry. Letters of inquiry are generally used when foundations are seeking unsolicited proposals, and a letter of inquiry writes to us and says, is this something you might be interested in? Since we're defining the topics and products, we already know in general we're interested. So we don't have to have a letter of inquiry process. We are though going to substitute for that a letter of intent. Let's next slide. So if you go back to that, if you come to that grants page and you click on the top box, Request for Proposals, what you'll get to is this next slide, which is the RFP, which you can download as a PDF if you like, and it lays out all the things that we're covering today in this webcast. The next slide, I believe, talks about these letters of intent. We would like to have them submitted by 1 month from now. We will let you know that we receive them, but we probably will not be giving any feedback on them. So we want to know what's coming in, what the topics are. If some of them are way off topic and not likely to be considered, then we'll try to get back to you so you don't spend time working on a proposal that's just not going to be successful. But in general, I don't think that's going to happen, and so I don't think many, if any, people will receive any kind of feedback from us except that the letter of intent was received. We've outlined a form that you can download from the website, and it's also embedded in the RFP of the kind of things we want to know in the letter of intent. There's a part of it is actually formatted just to give us names and contact information, and then we would like, in no more than 2 pages, these next 5 items to be briefly discussed. A project description which includes the issues to be addressed and the design and the preliminary timelines that you're anticipating. Who you think will be the key staff and participants, what do you expect the long-term outcomes of this work is going to be, and what are the goals you expect to be addressing and the objectives you expect to be addressing. Any ideas you might have for disseminating the products or the lessons learned through this grant process, and identifying potentially some barriers and limitations to success of this. Next. So the full proposals are going to be due September 15th. So our general guidance, I showed you a slide on that, and you ought to read through it. And our forms, some of which there are no forms specific to this RFP. So these are the typical forms you have to fill out from your institution on tax exemption or other things like that. And budget forms and other things. One of the things, somebody sent in a question already prior to the webcast, saying that on our website we make some priority about applying to kids in California. In general, all of the work we support is applicable to kids in California as well as is to other children in other places, and so you need not to address that at all. That should be obvious that you're making recommendations that are in general good for all children with special needs. Next slide. Now this is in your RFP. It's a general outline of the things that need to be in a proposal. I don't think there's any surprises here. We would like an executive summary with the kind of recommendations you expect you're going to be making. Obviously, you won't have the recommendations at that time. We'd like you to discuss the opportunities there are for change in the systems. If there aren't any, then we're going to bump our heads against the wall. You need to say why you selected the topic that you have chosen. Don't have to go into great detail about it since we've already done some pre-selection, but why particularly have you selected the topic from among the 6? You need to document your capacity and expertise to do the proposed project. You need to lay out how you're going to go about it, the timeline, and what interim products might come up during the 6 to 9 months. You need to have a budget justification. You're going to need to have identified the people who are going to participate, and it would be good to have letters of intent of participation from each of those people. And we need a project budget and the other application forms. All this should be pretty clearly laid out in the RFP. We have no particular preference for any type of applicant. We expect applicants to have the qualifications to do the work. We encourage collaboration among or consortiums of institutions and organizations, although that's not necessary. And we strongly encourage consumer participation in the products. Our proposals will be reviewed and evaluated on how well the content areas are addressed, the ones that we've listed before in the project outline. And what we want to see is that the projects have the potential to yield feasible evidence-based guidance. And in some of these cases, we're going to have to define evidence-based pretty broadly to include expert opinion and experience, but have the potential to change toward changes that will improve the system of care for kids with chronic illness and complex conditions and their families, and that will achieve the aims of better health, better care, and better value, the triple aims, as all of you know. So, final comments. Please read the RFP carefully. Your brief letters of intent should be submitted 1 month by 1 month from today. If you're interested in collaborating with other applicants, because we expect there will be overlap of interests from different people, if you're interested in collaborating with somebody else, there's a little box on the application form that says you are interested in collaborating with somebody else. And if you are, then we'll take that as an opportunity to connect you with people who have proposed working on the same topic, and you can see if you want to work with them or not. Full proposals are due September 15th. And we will notify people of who will be receiving their grants during the first week in November. Once that has taken place, and during the 6 to 9 months of actual work, we intend to use conference calls and perhaps some in-person meetings to facilitate communication among the selected grantees, in part so that the final reports look somewhat alike, but also these topics overlap in ways, and we want to just facilitate communication. So the next slide is websites to find the RFP. If you want to read the symposium proceedings or look at the webcast of the symposium for background and see what the national experts who presented there had to say about these various topics. These are really good resources. If you have questions about the procedures of preparing either a letter of intent or a proposal, you can contact me or Tiana George. And you should submit letters of intent and proposals to the website at the bottom, grants@lpfch.org. So let's see if we have some questions now that you have raised. You're free to put some in. Unfortunately, my little box is really small. See if there's a way to make it bigger. No. Maybe one of my assistants is going to come in and help me with this. Hold on just a moment. Go ahead. Generational technology issues. Okay, are pediatricians and health plan administrators involvement absolutely required? Or is it a suggestion? It's strongly encouraged. Our feeling was that it would be really difficult to come up with feasible action plans that were well informed if you didn't have those types of people involved. You're welcome to create your work groups however you like, but you're going to need to justify that they have the capacity to do the work. One of the next question was, or really a comment. It seems like all of these topics overlap, and to focus on only one area seems counterproductive. I empathize with that. I deal daily, as do most of you, with trying to figure out how to improve things. But our thought was that we need to take bites of this elephant that we can deal with. They obviously interact, but our feeling was that separating them and trying to move forward on different pieces is likely to at least give us the building blocks to move forward. I think that's a constant frustration of those working in this field. The next question was about the 6 topics, and someone suggested that there were only 5 listed. The RFP, I'm pretty sure, lists 6. I'll double check that. There are 6 in the RFP. So they include tiering, family participation, life course health, using state Medicaid quality measurements and data to drive program improvement, providing care coordination to address medical and social complexity, and assuring integration of various aspects of long-term care. So I hope that clarifies it. Any additional questions? Let's wait a moment and see if people have others. You're welcome to send in questions after this. We won't respond individually, but we will post them as a FAQ on the website attached to the RFP. We do have some more. They were at the top. I was looking at the bottom of the list. How do you find healthcare administrator? Good question. We're really interested in somebody who has some administrative responsibility for running a health plan that it has responsibility for serving children with special health care needs. That could be a managed care organization, it could be a hospital practice group, or some other variation of that. How do you define long-term care? We're talking about children who have chronic health problems. And complex health problems. I don't think the typical diagnosis of something that lasts more than 3 months really applies. I think we're talking about children who have, by and large, lifetime conditions. I would include in these some conditions that we can, if not cure, put into remission. It was asked whether post-acute care is included. Sure, post-acute care for children with long-term care problems would be part of that long-term care system and can be included. Any suggestions about how to distribute the funding among those who participate? It's not a large sum of money. My advisory committee, though, said it was sufficient. This is mostly, as I said, there will have to be some work on reviewing the literature, but the symposium and Other sources really have reviewed a lot of this, so I don't think the background section is going to take much time. Mostly it's developing a process to identify the sub-issues within each of the topics that we've identified. Dividing up the work among a group, having conference calls, and if necessary, bringing people together in person to work out the content of the report, and then someone obviously has to be responsible for writing this report. So we believe that the sum is not large, but sufficient to support whoever is the PI on this and whatever administrative support they need, and to give honoraria to work group members, and there's probably still money in there to bring people together if need be. Okay, now let me get some more questions here. Can a state-specific organization apply? Yes, of course. Do you have a posted cap on indirect rates? Yes, right now it's 10%. And that's on our general instructions for proposals that are sent to us. You'll find that kind of budgetary guidance. We're interested in, one question was, are we only interested in family engagement, or are we interested in family participation? We're interested in meaningful participation of families in the development and operation of programs and policies. Okay, those are, I think, the questions that we have. Let me see, there's some more now, new ones at the bottom. The grants would actually start, the timeline for these projects is on the last page of the RFP. The project start date we're setting as December 1st. We expect award letters to be mailed the first week in November, and they need to be back to the foundation as soon as your institutions are able. And once they're back, you're free to start. We're expecting that will be somewhere around December 1st. It could be earlier depending on your institution. Any other questions? Okay. If not, then thank you for participating. I hope this has been helpful. If you have questions that come up, email them to me or to Yana George, and we will try to post answers to them. And we look forward to hearing from you. Thank you all very much.